Yeah, Dr. Henry, given the fluctuating supplies of Pfizer versus Moderna, do you have a ballpark percentage of people in BC that will be getting a different mRNA for their second dose than their first? I'm wondering if there's kind of a ratio there that you're expecting. And is the supply of Moderna making up for the lack of supply of Pfizer? Basically wondering overall what this will mean for our timeline overall, if it would maybe accelerate it or perhaps back it up a little bit.
Yeah, I actually don't have a good idea of percentage of people who are getting an alternate mRNA for their second dose. It has varied a little bit by clinic and by area of the province, and it mostly was people with earlier on Moderna not being available because we had challenges with shipments of Moderna. As you know, we've received a whole bunch of Moderna just in this past week, and we're expecting to receive more before the end of June and into early July, at the same time that we've just heard there's a delay and some challenges with Pfizer. So I don't, overall, we are getting a net increase in vaccines in June. So yes, it can and will make sure that we can move up our timelines, but we also want to balance, because we know that a slightly longer interval is a good thing. So we can move up a little bit, but somewhere around that 8 weeks is probably still a good thing, maybe as low as 6 weeks. So that will take us into the end of July or early August. But it absolutely is a net increase in the amount of vaccine that we're receiving. And so, yeah, we can get everybody, every adult or everybody over age 12, at least with their first dose by the middle of July or end of July now.
Tanya, do you have a follow-up?
And I hope I'm not too optimistic.
Yes, please, and if we could get an answer from my colleagues, from Minister Dix in French as well. Thank you. We know BC is in a much better place these days, but what do you expect to see in the next few weeks? What are you watching most closely at this point to make sure our positive trajectory continues, I guess, vaccination aside? And given the Delta variant isn't spreading rampantly here right now, is it still the biggest threat to our success?
Yeah, you know, I think there's a couple of things that are threats that I'm watching really carefully. And as you know, next week's a big week for us as we're watching the data as we get closer to July 1st. And we'll have more to say about that next week. But absolutely, we're watching, as you know, we're doing whole genome sequencing on all of our cases. When you have smaller numbers, that makes that even easier. We're also watching very carefully what strains are circulating. And I've said this before, you know, it's not like they're an alien, that virus that in space that we can shoot down. It's about the virus that's being transmitted between people. So the actions that we are taking to prevent transmission, and that means the basic public health work that our EHOs and our medical health officers and our public health nurses and our contact tracers have been doing from the very beginning becomes more and more important. And we're going to continue to pay attention to that, making sure we identify people, that we've got testing, rapid testing available for people with the PCR tests, and being able to stop those chains of transmission as quickly as we can, because that's really important as we're still in this transition phase. And we've seen it can take off with the non-vaccinated community quite quickly. And that's the challenge with the variants like the Delta variant, in that it's more transmissible. So yes, we are watching that really carefully. And, you know, that's where we're seeing some glimmers of hope too, that the teams across the province, as tired as they are doing an amazing job at finding people, supporting people. And, you know, I talked about this with my colleagues, 150,000 people in British Columbia, and public health has talked to every single one of those people who've been sick with COVID-19, and making sure that we can manage this. And we know a lot about how this virus is transmitted and the things that we need to do. So those are the things that we're continuing to follow, as well as immunization, of course.